Hi everyone, I'm Anna and this is the recording for my neuro exam checkoff. I have already washed my hands prior to entering the room, and I'm now going to introduce myself to my patient, ask them their name and birthday to begin my neurological exam. So, hi there, I'm Anna. Could you go ahead and tell me your name and birthday for me?
Samantha Victor, 11/16/92.
Perfect, thank you so much. So just based off of general appearance and first interaction, the patient does appear to be neurologically intact, and the general appearance does not appear to be in any overall distress or discomfort. So to begin the exam, we are going to start with assessing sensation in the facial area. We'll do that in 6 different areas, Sam, and for that what I'm going to do is just take this tissue here, and what I want you to do is tell me now when you feel it. So I'll have you close your eyes.
No. 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 No.
Perfect, thank you. And so we do not notice any decreased sensation in the face right off the bat. That is also testing Cranial Nerve 5. We will do more for that further down in the exam as well. As we continue though, it's testing for the cranial nerves. We're going to do all 12 cranial nerves. And so we will start with Cranial Nerve 1, the olfactory nerve. So for that, first I'm just going to have you occlude each nostril and kind of sniff like you're smelling the flowers. Go ahead and do that for me. Good. And so I'll have you occlude one nostril now and close your eyes. I'm going to grab a smell here for you to identify. Go ahead and smell.
Vanilla.
Perfect. And then open your eyes and occlude the other one. We'll do the same. Go ahead and close your eyes. Smell.
Cinnamon.
Good. All right. So the olfactory nerve 1 appears to be intact. Cranial nerve 1 appears to be intact. For cranial nerve 2, that is the optic nerve, and so for that we would generally do an acuity test. We do not have the capability to do that here at home, but we would do that in the office. So what we will do is test the visual fields, and I will examine Sam's eye with an ophthalmic scope. So to test the visual fields, Sam, if you kind of get more direct across from me, we're going to cover each of our same eyes. So, well, you're going to cover your right eye, I'm going to cover my left eye. And then what I want you to do is tell me when you can see my finger, okay?
No. No. No.
Perfect. And let's do the same with the other eye.
No. No.
No. Perfect. Thank you. And then go ahead and sit back where you were. I'm going to examine your right eye with my right eye, and you're going to shine this light in your eye, and we are visualizing the red eye exam, also visualizing veins and arteries, making sure that ratio is normal, also looking for any pallor or other abnormalities. I'm going to do the same with the other eye. Make it in front of me here. And again, no abnormalities noted in either eye. All right. For cranial nerves 3, 4, and 6, we assess the extraocular movements in those muscles. So for that, Sam, what I want you to do is follow my finger without turning your head. So. Perfect. So all of those cranial nerves do appear to be intact. Another one we could examine for as well is convergence, and just making sure her eyes follow my finger as I move towards closer to her face, which they do. For cranial nerve 5, which again we tested the sensory part of in the beginning of the exam, we can also test kind of jaw movement or mandibular movement. And so I'm gonna have you Sam, open your mouth like this and then push against my hand. Good. Same with the other side. Good. So cranial nerve 5, the trigeminal nerve does appear to be intact. Moving on to cranial nerve 7 is the facial nerve. For that, Sam, I'm going to ask you to do a couple things to make you feel a little silly. So what I want you to do is show me your teeth. Good. And then close your eyes real tight. And raise your eyebrows up, wrinkle your forehead. Good. And then puff up your face and your cheeks. Perfect. So cranial nerve 7 appears to be intact. For cranial nerve 8, that is the acoustic nerve. That is going to assess for hearing. So for that, I'm going to come behind Sam. Sam, I'm going to have you cover your left ear for me, and then repeat after me.
3, 2, 1.
Okay, and then cover your other ear.
Red, white, blue.
Perfect. If we were to notice any decrease in hearing in that exam, we could do a Weber's test or a Radialis test to further assess that. So whether it's a sensory neural thing or conduction, but we are not going to do that for this exam. So for cranial nerves 9 and 10, that is going to assess movement of the soft palate, the uvula, and the gag reflex, the vagus nerve. And so for that, Sam, we normally have a light to really fully examine, but we're pretty well lit here. So for that, first, what I'm going to have you do is open up your mouth and say ah.
Ah.
And so when I see that, I see her uvula rise. It is midline. As we're doing this part of the exam, you could also assess for some parts of cranial nerve 12, which is just assessing the symmetry of the tongue, making sure there's no vascular abnormalities. We'll now initiate a gag reflex, so stick your tongue out for me. Perfect. And so the gag reflex is intact, so those cranial nerves appear to be normal as well. And so moving on to cranial nerve 11, that is the spinal accessory nerve. For that, we will do a shoulder shrug test, making sure strength is equal on both sides. So I'm just going to have you shrug against my hands for me and relax. Perfect. So strength appears to be equal, no weaknesses were noted. And then for cranial nerve 12, we've kind of already assessed. The main thing we're assessing for with cranial nerve 12 is articulation. So when I assessed for her hearing and she articulated those words clearly, that was a sign that cranial nerve 12 is intact. Also, as we were examining the mouth and the oral cavity and the tongue for the oral exam there, that we were assessing for cranial nerve 12 as well. So moving on, we will start assessing for sensation in the upper and lower extremities. So for that, I'm going to start with the light sensation again, just like we did with the face. So Sam, what I'm going to have you do for this is just say now when you feel it. So I'm going to lift up your shoulders so it's a little easier, or your sleeve here.
No.
And then we'll do the radial
No.
and
No.
ulnar parts of the hand. Upper extremity.
No. No.
Perfect. Let's do the same with the other side.
No. 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 No.
Perfect. We will now do the sharp and dull test. So Sam, this is going to be sharp, and this is dull. Perfect. So again, your eyes are closed. Let me know what you feel.
Dull. Sharp. Dull, sharp. Dull. 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 Sharp. 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 Dull.
Good. As we're up on the upper extremities, I'm going to also, Sam, keep your eyes closed, and I just want you to tell me which way. Hold your hands up a little higher off your legs. I just want you to tell me which way I'm moving your finger.
Up. Down. Up. Down.
Good. Get my video back on here. All right, moving down to the lower extremities, we're going to do the same thing. obviously it's going to be a little difficult with leggings on. Most patients would be in a gown. So we'll start with light sensation. Important on the lower extremities as well is to do medial and lateral sensation. So just say now when you feel me touching.
No. 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 No.
Good. All right. And then moving on, again, tell me, same tool that I'm using for sharp and dull. So just say when you feel either one, okay? So close your eyes.
Sharp. Dull. Dull. Sharp. Dull. Sharp. Dull. Dull. Sharp. Dull.
Perfect. So we do not notice any loss in sensation or any neuropathy. We'll also do the position test for one toe on each foot. So Sam, just keep your eyes closed. Tell me which way I'm moving your toe.
Down. Up. Down. Down.
Good. So sensation appears to be intact. While we are here as well, we will go ahead and do tests for coordination. And so for that, we're going to do a heel to shin test. And so Sam, what I want you to do is just put your heel on your shin and drag it up and down your shin for each leg. Perfect. We will also we'll test for coordination another way as well, but we'll move on and test really quickly stereognosis and graphesthesia. So for that, Sam, I'm going to have you close your eyes again. What I'm going to do is I'm going to place an item in one hand, so hold your hands open on your thighs for me. Good. I'm going to place an item in one hand, I want you to identify it, and I'll place another one in the other hand and have you identify it there, okay?
It's a coin.
Perfect. And then we'll do the same.
It's a pair of keys.
Good. All right. Okay. Moving on, you can open your eyes. Perfect. We will be assessing your reflexes. And so for that, I'm going to try to think if we did everything there. All right. We will do, actually, while we're still with the lower extremities, I'm going to, in the sensation part of the exam, I'm going to do the vibration test. So Sam, I want you to tell me when you stop feeling the sensation, okay? So hold your hands out.
Stop.
Good.
Stop. Stop. Stop.
Good. Camera back on. Okay. Alrighty. Now we will move on to the reflex part of the exam. So we're going to start by assessing the biceps reflex. So Sam, if you could kind of relax both arms on your thighs there, kind of just with your wrist relaxed just like that. I'm going to place my finger here and then tap. And we're just looking for the flexion of the bicep muscle. And then we're going to do the same thing with the triceps, just above the elbow. Good. We'll now assess the Brachial Radialis reflex. So just a couple inches above the wrist. We're just looking for flexion in the wrist and fingers. Just relax your arms. Good. Good. Now we will assess the patellar reflex, and so this bench is a little bit low, but I'm going to try and get you in a relaxed position here with your knee. Palpate that area. Good. And then the other one. Good. Now for the Achilles reflex. We'll hold your foot up here. I'm looking for that plantar flexion reflex here. You see it there. All right. And I believe that concludes the neurological checkoff exam, and so this patient appears to be neurologically intact. No sensation deficits were noted. Thank you.